So coming toward this Fanconi
Recording in
syndrome,
progress.
so just remember this is just a reabsorptive defect, okay? A renal tubular reabsorptive defect, okay? Just remember this. Renal tubular side effect it is, okay? So, so just remember here you are going to, how you diagnose it, just remember you are going to find out, so this glucose in the urine, still the, the value of the, glucose in the, body is normal, okay? Mostly how you find the urine glucose is like, in the diabetes mellitus, high glucose in the body that will cause glucose uria, okay? Just remember that's how it happens, okay? But how, but in this disease, glucose uria is present in spite of having normal glucose in the blood, okay, normoglycemia in the blood, okay, with the typical, despite of this glucose, okay, that is actually the thing you are going to find out here, okay. Along with that, in the urine, you will find a lot of things like protein urea, ketone urea, other things will also be, will not be reabsorbed in the urine, like phosphorus will be there, sodium will be there, potassium will be there, a lot of other things will also be there. So there was this Zuku question that which one of the following you are going to find out in the urine, okay, in case of Bessenger syndrome. So the options were glucose, potassium, phosphorus, okay. So, but the answer is all of the above. All of the above you are going to. So this is just tubular defect, okay. It doesn't know. It doesn't. Doesn't matter. It is not specific for the glucose. Just remember this, okay. So just remember this. That is actually the diagnosis. For the treatment, just remember you just need to. The animal. That if the animal is in the uremic crisis, put the animal on the. A lot of fluid therapy. That is actually the treatment. And use the Gonto protocol. This was actually used in the humans, okay, but you can use here, okay. So here you are going to use the oral sodium carbonate hypokalemia by giving the potassium gluconate or potassium citrate enema. And acidemia both, okay. Just remember this, okay. What is the Gonto protocol? So just remember you're going to use vitamin in the mineral replacement in the animal, like that is like for the life you have to give it, okay. Just remember this. And another thing is the uremia could lead toward the seizures in the end stage animal, okay. All in all, just remember the lifespan is not reduced in case of Bessenger syndrome. If you are, managing these conditions, it's like very normal to have normal life, okay. But end stage CKD can cause the death in the animal for 40% of the dogs, okay. Just remember this. Next is this, we can discuss this pyelonephritis. That is one of the topics. So just remember this is a very disturbing kind of topic, okay. Like we don't actually know how to diagnose this pyelonephritis, okay. So coming toward this pyelonephritis, so this is actually the inflammation of the renal pelvis. I actually have shared a question for about the pyelonephritis earlier yesterday. So just remember the inflammation of the renal pelvis and the interstitium. So it due to the bacteria. Acute pyelonephritis is very uncommon. Usually you find the cases of the chronic pyelonephritis that is more, common, and you actually do not find any kind of clinical sign in the chronic pyelonephritis. Okay. You can also say pyelitis, okay. So it's common in the female, dogs, okay, or cats, okay. So the risk factors could be a lot of things like ectopic ureter could be toward this urethral, and ureteral obstruction could also cause you could have perineal, urethrostomy could have this uh, pyelonephritis, just remember this. Coming toward the, the clinical presentation of this pyelonephritis, you are going to find out ascending pyelonephritis. Most of the time, it's very rare to find out the hematogenous pyelonephritis. First of all, okay? Clinical sign, you are going to find the same signs like the CKD, polyuria, polydipsia, in the chronic pyelonephritis, malaise, in the acute pyelonephritis, in the physical examination, you are going to find in the acute pyelonephritis, you are going to find out fever in the animal, okay? And renal megaly, you will find in the acute pyelonephritis, okay? In the chronic pyelonephritis, you will find out renal asymmetry, okay? Abdominal pain in the acute pyelonephritis only, okay? Not in the chronic one. Chronic one is actually the one with without any clinical signs with the renal asymmetry. That's it, okay? So the pyelonephritis can occur hematogenously or as an ascending infection. Most of the time it occurs as ascending infection, and it is the chronic one is the more common than the acute one. Okay, just remember this. As far as the diagnosis is concerned, so you have to consider the, pyelonephritis in any animal with, pyuria or bacteriuria, with the polyuria, polydipsia, azotemia, any patient of the CKD, okay, you have to consider the pyelonephritis in these animals again. Okay. So you need to evaluate the animal for the different kind of anatomical abnormalities. Okay, check the CBC of the animal. You're gonna find out, in the acute pyelonephritis, you're going to find out increased neutrophils in the animals. Okay, you could find out no non-regenerative anemia in case of CKD. That could be a possible reason for this pyelonephritis. Okay. So usually the biochemical analysis or biochemical profile is going to be the normal. The only thing you could find out is azotemia, hyperphosphatemia, hypokalemia. Urine analysis will show the isostenuria in the animal. And you can check the blood pressure in the animal. Okay. You need to do the abdominal ultrasound in the animal. You need to check out the, the diameter of the renal pelvis. Okay. Normally it should be like 1 to 3.8 mm, median. Usually it is 2 mm. Okay. Just remember that 2 mm. And in case of this pyelonephritis, the pelvic renal pelvis dilation will be there. Okay. That is actually the diagnosis of this uh, pyelonephritis on the ultrasound. Okay, so yesterday the question answer was this ultrasound. You diagnose the pyelonephritis on the ultrasound too. Okay, as far as the urine culture and specific, culture and sensitivity is required, you usually can do it before the treatment when you suspect the pyelonephritis that it exists. Even if the urine sediment is inactive. You first of all just remember whenever the urine sediment is it is positive. Okay, you actually have to go for the culture and sensitivity. Okay. So here they say even if it is negative, you need to do the culture sensitivity. Okay. In case of pyelonephritis without any kind of signs like the chronic pyelonephritis, the culture could be negative, and for that you actually have to do the culture and susceptibility again. Okay. So that's the reason actually we actually said yesterday that culture and sensitivity is not the specific diagnosis for the pyelonephritis. Okay. So rarely you can confirm this pyelonephritis. So presumptively, just remember the physical findings, the clinical, findings, the lab finding, and the ultrasound actually tells you, that this is pyelonephritis. Okay, just remember. So you can do the ultrasound guided pyelosynthesis in the animal to, from the renal pelvis for the culture and sensitivity in the for the culture and sensitivity. Just remember this, okay? So all in all, you're gonna find out that the pyruvate in the animal. Okay, so blood culture can also help if the animal is in acute pyelonephritis. Okay, so that is about this diagnosis of pyelonephritis. So mainstay in the treatment of this pyelonephritis is actually the antimicrobial drug. Okay, so you have to use the antimicrobial drug based on the culture and sensitivity whenever possible. it's better to use oral route, and but you cannot use oral relief if the animal is actively vomiting. Okay, so in the before the results of the culture and sensitivity, you actually have to use the empirical antibiotics that actually covers the gram negative bacteria and that are actually bactericidal. For example, fluoroquinolone, you need to give you give the enrofloxacin in case of dogs, and you give the protofloxacin in case of cats. Just remember this. Enrofloxacin causes the in the fluoroquinolone causes this retinopathy in the cats. Okay, that's why you don't use in the cats. You can use in the dogs. And protofloxacin use those in the cats. Protofloxacin doesn't cause that. Okay, just remember that. Other thing that you will use is amoxicillin, but it is less efficacious in the pyelonephritis. And another very common antibiotic you can use is TMS. We have discussed it in the cystitis. You can use the TMS. Okay. So just remember the for the intact male dogs. You need to use the antibiotics that can penetrate the blood prostate barrier too, like TMS and fluoroquinolone. Both of them can cross the prostate barrier too. Okay, just remember this. So for how much time you have to use the antibiotic, you need to use the antibiotic at least 3 to 6 weeks. Okay, and that's like very much recommended. And along with that, you actually have to do the urine analysis every week to check the urine sediment. Okay, so along with that, you need to give the urine, the supportive like fluids, a restricted protein diet, low phosphorus diet to these animals. Okay. So you need to use the drugs that are FDA approved, like the fluoroquinolone, the protofloxacin in the cats, and the enrofloxacin in dogs. Okay. Avoid use the TMS in case of Doberman. Just remember that TMS can lead to the keratoconjunctivitis, the hepatopathy in case of Doberman. Okay, it's very important not to use these TMS in case of Doberman Pinscher. Okay, just important. It's very much important. Okay, you need to repeat the culture and sensitivity every 2 weeks after the completion of the antibiotics. Okay, in these animals very much important. If the initial urine culture and sensitivity is negative, despite of this that you actually suspect the pyelonephritis, then you actually have to increase the water consumption with the antibiotics and then do the culture and sensitivity again. Okay? The prognosis for this pyelonephritis is actually guarded. So all in all, just remember whenever you'll find piloeptasia on the ultrasound, one of your differentials should be this the pyelonephritis. Okay, pyelonephritis, hydronephrosis. These are your two differential diagnoses. Okay, just remember pyelonephritis is treatable if you do the early intervention. Okay, just remember this. Okay? Otherwise, it's gonna lead toward the tubular dysfunction. Okay? That was pretty much about the pyelonephritis. Our next topic is this transitional carcinoma. Just for the case presentation of the the pyelonephritis, it could be like this. The animal is in fever, abdominal pain, and on the palpation, large kidney. The animal is vomiting too. Then on the you did the find out and the minimum database you'll find on the the urine also you find out the leukocytes too. Um, Another thing is you find out azotemia. Then you went for the ultrasound. In the ultrasound, the the pelvis is increased in size. So what is your suspicion for this disease? Okay, so the suspicion for this disease is going to be pyelonephritis. Okay, that's going to be the case presentation. Okay, just remember it is like very high chance pyelonephritis. Okay, just remember it again. So just have this 5 minutes break, then we'll start again. Okay.
Recording stopped.
Hello guys, let's start our topics again.
Recording in progress.
So coming toward this FLUTD in the cats, okay, after the FLUTD or before the FLUTD, we have to discuss the urethral obstruction in the animal, that how you actually can manage the urethral obstruction, okay. Coming toward this urethral obstruction, this can occur due to a lot of things like, any kind of urolith or any kind of matrix formation, any neoplasia, structural infection. So these are actually less common. The most common is actually the urolith or this matrix formation, okay? So very common in the cats as compared to the dogs, and the males are actually predisposed due to the small size of the lumens of the urethra, okay? So we have discussed it yesterday too, that in the male dogs, it's like very unlikely to do this urohydropropulsion to be successful. The ideal candidate for the urohydropropulsion is. So just remember, this can be a risk factor of, the risk factor of the urethral obstruction could be FLUTD. Yes, neoplasia, urinary tract obstruction. So these are like the risk factors. Okay, that could be associated conditions. The post-operative diuresis. This is very much important associated condition. So I will discuss that what this post-operative diuresis is. Okay. So what are the signs you are going to find out in the urethral obstruction is just remember the signs. Very much important that actually help you classify different type of the urinary signs like lower urinary tract signs or upper urinary tract signs. Okay. So you are going to find out plaqueuria, dysuria, stanchuria, anguria, oliguria, hematuria. So these are the things. Okay. Small urine, strength urea is like difficult urine, anuria, less urine, hematuria, with the blood. So these kind of things you're gonna find out, okay? Along with the lethargy, the systemic signs, you can also find that out, okay? On the physical examination, you will find out enlarged, turgid, toned urinary bladder. That is very much characteristic, okay? And you actually have to differentiate it from the this upper motor neurons sign, okay? But just remember, urinary catheter is actually our differential sign. That's how we actually differentiate upper motor neuron disease from the enlarged just obstruction. Another thing is upper motor neuron disease. I will have some other kind of signs like any kind of lameness too in an animal, okay? But here you don't find any kind of that thing, okay? So here you could also find out, bradycardia in the animal due to the hyperkalemia. Okay, so just what happens is any kind of urinary supersaturation due to any kind of issue like urinary tract infection. So what happens is that urinary supersaturation will cause the matrix formation leading to the urolith formation. Okay, that urolith will can dispose, the- dislodge in case of male cats in the urethra leading to the urethral obstruction. That's how it happens. Okay. So, what's a typical case? So, any male cat with the straining to urinate with the enlarged, firm urinary bladder on the palpation, that's a typical presentation of this. So, differential diagnoses are going to be like Desperser, atony, FLUTD, reflex dyssynergia. So, can anyone let me know what is a typical case of a reflex dyssynergia? We have discussed it. So just remember so how you diagnose these cases. So just remember you do the minimum database in these animals. CBC is unremarkable in these animals. You actually find the hyperkalemia, in these animals. Uh, Very much important and very just one important thing to a question. Urethral obstruction is a medical emergency or surgical emergency. Just remember, you have to pass the catheter in this. Is it a medical emergency or surgical emergency? Okay, 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 okay. It's a medical emergency, guys. क्या हो गया है? Whenever hyperkalemia comes first, you actually have to manage it, medically. Then comes anything else. Okay, just remember this. We have discussed that in the urinary bladder rupture too in the equine. That whenever this comes first, you need to treat the hyperkalemia. Otherwise, animal is going to, pass to God due to the bradycardia. Okay? So whenever you will find hyperkalemia, that's gonna be medical emergency. Okay, so there was this question like which of the following is the first treatment in case of urethral obstruction. First, your what these are the options: fluid, A, B is pass the catheter, C is something else, yeah, or both. Okay, so answer is you need to give the calcium and give the fluid. Okay, that's the thing. You need to check out this hyperkalemia. Okay, in the urinalysis you are going to find out this hematuria, crystalluria, biuria, epithelial cells. These are the things you'll find in the urinalysis. Okay, uh, you could also do this, the radiograph. You can find out the renomegaly and some kind of urolith in the animal. On the ultrasound, you can find out the piloactesia. It's very much important to do this ECG findings. You actually need to know that what are the signs or what a typical ECG you will find in case of, hyperkalemia. So just remember, in case of hyperkalemia, you will find out no B wave, wide QRS complexes, and bradycardia. Okay, just remember this. Very much important. In all the exams, the A or NAVD or whatever. So just remember, it's very much important for you guys to practice the different kinds of ECGs. With the hyperkalemia, with the hypokalemia, with the hypercalcemia, with the hypocalcemia. We'll discuss the arrhythmias one day. So you can do this widening cystourethrogram in the animal to check out, urethral obstruction. Okay, just remember this. Coming toward the treatment, that's the main important thing. So just remember the first thing you do in the acute treatment you do in the animal is actually the IV fluids. That's the most important thing you do. So give it 5 to 10 ml per kg in the sedation and analgesia by so fluids are the first thing you need to give, crystallized fluids, the 5 to 10 ml per kg per hour. After that, you need to give the maintenance doses like 60 ml per kg per day. Okay, then, this is actually due to for the potassium. If the potassium is more than 7 milli equivalent, first thing you need to use is actually the calcium borogluconate. Then you can start with the fluids and, sodium bicarbonate to carbonate and insulin and dextrotherapy. Okay, that's the thing you need to do. Okay. After that, you need to, gently massage the, the tip of the penis. There's sometimes you actually find the obstruction just at the tip of the, penis. Okay, so you can just massage it and remove it. Okay. Otherwise, after the fluid therapy, then you have to do the urethral catheterization in the animal without any kind of sedation in the male dog. Okay, just remember if they actually if they do the they show some kind of resistance, then you can go for the sedation and season the animal. So just remember to put the rubber rat rubber catheter in the animal. uh, so you first to lubricate lubricate this catheter and then pass it. Okay, in the male cats, you actually need to use this 22 gauge 1 inches IV catheter. You can use this for the dislodgement of the urethral plug. Then you can easily use this Tom catheter. Okay, just remember this. Once you have passed this, you actually have to do this first flush the bladder, then put it as an indwelling urinary catheter. Okay, just remember that. Just wanted to ask one thing. Can we use the antibiotics um, as a prophylaxis of the of the indwelling urinary catheter infection. There could be chances of indwelling. We are doing the indwelling urinary catheter. There could be chances of indwelling urinary catheter infection. Okay, can we use antibiotic as a prophylaxis of this indwelling urinary catheter infection? So you need to use this indwelling catheter in the animal. So just remember, you need to replace the red with this propylene, polypropylene, catheter. Just remember this. So you have to maintain this per catheter at least for the 3 days. Okay. Yes, there is never use the antibiotics diet. Okay. So after passing the urinary catheter, you need to, put it at this place for at least 1 to 3 days, okay? And just remember, incontinence will be there. For that, you need to use this phenoxybenzamine, okay, in the animal. Very much important. Other is you need to identify which kind of urolithiasis is there, and then you have to monitor and address and prevent those kind of urolithiasis in the animal. So perennial urethrostomy can be done in the cats or the dogs with recurrent obstruction. Okay, just remember this. Perennial urethrostomy. In case of urethral neoplasia, you can do this, tube cystostomy or the urethral stents too. Okay, what could be the possible complication of the hyperkalemia of the urinary obstruction? Hyperkalemia is actually the complication. Urethral tear could be there. Urinary bladder rupture could be there. UTI could be there, and just remember, you actually have to monitor the serum. After the removal of the obstruction, the animal will show a lot of post-obstructive diuresis. So during the urine obstruction, the major thing you are concerned about is actually this hyperkalemia. Okay, after relieving the obstruction, post obstructive diuresis will be there. A lot of diuresis will be there. Okay, when you remove the obstruction, your main concern is going to be like hypokalemia. Okay, that is your going to be main concern. The animal will lose a lot of fluid with the loss of electrolytes. So hypo things should be there. Okay, hypokalemia could be your could be one of the main concerning thing that you are concerned about. Okay, just remember this. So just remember, urethral obstruction is a life-threatening condition. So you have to address the electrolyte abnormalities first. Then you can do that. The relieve the obstruction in the animal. Okay. So just remember, in the cats, this FLUTD and the urethral obstruction overlaps. Okay. Just remember, we'll just discuss the FLUTD now. Okay. So FLUTD is actually due to some kind of environmental stress associated thing. Okay. Just remember this. Coming toward this FLUTD, just remember what could be the risk factor of FLUTD. First of all, just remember male cats usually get the UTI more than the female cat due to that the narrow penile urethra. Okay, that's very much we have discussed that. That's the reason that we cannot use the male cats, male dogs or male cats for the urohydropulpulsion. Okay. So another thing is, just remember, any kind of stress, any change in feeding, litter boxes. So just a question for you guys: if in a cat house there are like 6 cats, so how much litter boxes should be there? Okay. So change in the feeding, owner schedule change, neutering, okay, indoor housing, increased weight, obesity, decreased activity, multi-cat house, any guest in the house, okay. So these are different kind of risk factor that could lead toward the, uh, the this FLUTD in the cats. Okay, just remember this. So what could be the clinical signs or the history in the animals with the FLUTD? So just remember abrupt onset of FLUTD can occur in a young adult cat at the first reference. So animal will show unpredictable stanguria, animal will vocalize vomit. Okay, so these things can happen. Okay, so stanguria is the thing you are going to find out. Okay, so physical exam finding, you're going to find out small bladder that is very much. So there could be like two, clinical presentation of FLUTD. Either it could be like obstructive FLUTD or it could be non-obstructive FLUTD. Okay. In case of obstructive FLUTD, you're going to find out, obstruction, large bladder. Okay. Large bladder, you're going to find out. In case of non-obstructive FLUTD, you're going to find out small bladder. Okay. So in case of non-obstructive FLUTD in a small bladder, there should be your differentials should also include the bladder rupture too. But just remember how you differentiate bladder rupture from non-obstructive FLUTD, because in case of bladder rupture, you actually have a lot of systemic effects, okay, like fever, vomiting, diarrhea. But that doesn't happen in case of non-obstructive FLUTD. The cause is actually unknown for FLUTD, okay. It can occur due to the stress and the environmental factors, okay. Just remember that, okay. So what is the diagnosis with, so in the urinalysis, you're going to find out, hematuria, hyperstenuria, protein urea, crystal urea, okay. Then urine culture and susceptibility. It's very rare you actually find the infection here, okay. So in the cats that are actually, I mean, came for this stanguria for the first time in the life, you don't have to do a lot of things. Okay, just do the urine analysis. You can do the urine culture in those animals, but only do the urine analysis and just do the management. Okay, we'll just discuss the management. When the animal comes again, you can go for the culture and the other minimum database things. If the animal, if the cats come for the recurrent episodes and or the complicated initial presentation, then you can, go for the radiograph, CBC, chemical analysis, ultrasonography. So these are the things that you can go for. Otherwise, for the first occurrence, FLUTD, urinalysis plus minus this urine culture can be done in that. Okay, just remember that. Yeah. It's very important that you know what things to run when the animals come with this diagnosis. Okay. So coming towards, I told you there are two possibilities of FLUTD, obstructive and non-obstructive FLUTD. In case of obstructive FLUTD, put the animal, establish IV catheter, put the, give a lot of fluids to the animal. Then after the, you have started the fluid, then you have to decompress the bladder. Okay, after the decompression, you can use this, the fluoxabexamine or the prazosin for the incontinence. Okay. Also important thing is to use the analgesics in these animals. Okay, post-operative diuresis occur very shortly, after the relief and after the re-addition of the animal. So during this, due to this, a lot of diuresis, we actually have to, replace the volume as lost in the urine. Okay, so this diuresis usually, continues for 2 to 5 days in the animal. Okay, so that is actually for the obstructive diuresis. Coming toward the non-obstructive diuresis, very much important, guys. Just remember these things. Very importantly, as a stepwise. Okay. So when first step you do in the non-obstructive FLUTs is MEMO. Okay, MEMO is a multimodal environmental modification. Okay. So just remember, provide at least one extra ball to the animals. Okay, like 1 litter box per cat plus one. Okay, if I say 6 cats, you need to give 7 balls. Okay, just remember that. If I say 6 cats are there in the house, you need to give 7 litter boxes in the house. Okay, just remember that. So multimodal environmental modification involves the litter, give the litter boxes enough, and just remember, place the litter boxes, in the sides, not in the, mid of the house. Okay, that's also the multimodal environmental modification. Another thing is provide them the safe places, like a place to hide. Okay, a very a place to explore, to provide them these kind of things. Safe outer spaces can be given to the animal. Trick teaching, working to at least 10 minutes a day can be given to them. Okay, so these are the things, like you need to, I mean, change in the environment for, to decrease the chances of FLUTD. Okay. So let's suppose you have done the first step, the multimodal environmental modification. Okay. And still it is ineffective. Okay. Then you actually go for the second step. Okay. Second step is actually using of that pheromone. Okay. Pheromone known as way. So consider the use of pheromone in these animals. Okay. Um, so just remember, if it is still ineffective, you need to use this to go to the step three. Right? So what is the step three? Step three is step one plus step two, along with the tricyclic antidepressants you need to use, like clopidogrel or amitriptyline. Okay? Or you can use SSRI, in like fluoxetine you can use. Okay? But you have to use at the lowest effective dose as possible. Okay? Just remember. Okay? So you need to use these TCA or SSRI only after step one and two. Okay, you cannot just move toward this at once. Okay, just remember this. Okay. So these are the stepwise thing. Okay. Just remember, if the animal show recurrent obstructive cases, then you need to go for the perennial urethrostomy in the animal. Okay, just remember this. So first step is multimodal environmental modification. Second step is Feliway, pheromones. The third step is use of TCA. Okay, just remember this, TCA or SSRI. Okay. Recurrent obstructive cases will you need to do this PU. Just remember this and put the also the important thing is in glycosaminoglycan. In the nutrition, you actually need to give the glycosaminoglycan. So it is very much important to give glycosaminoglycan. This actually repairs the epithelium of the bladder. Okay, just remember this. There's actually the use of glycosaminoglycan. Okay. So when you are introducing, put the, I mean, any other cat can house, introduction of any other cat can also lead toward this, stress to the cats and leading toward the, um, the FLUTD. Okay. So just remember that. And if you are using the SSRI, you actually have to never discontinue any kind of SSRI at once in the animal. Okay, so just remember that you have to use, you have to give it at least for 2 weeks, and then you have to taper it over 4 weeks. Okay, that's very much important. Okay. For the prognosis for the most common cause of this FLUTD is like idiopathic, and it's self-limiting. So prognosis is excellent. Okay, just remember this. So coming toward the drugs that you use commonly in the FLUTD, so acutely you use the analgesic in the animal. Okay, you can use the for the urethral contractility or the bladder contractility. You can use phenoxy or botanicol. The chronic anxiolytic activity, you can use the aminotraline or fluoxetine in the animal. Okay, but just remember, fluoxetine decreases the food intake, and the amitriptyline can decrease the can cause this weight gain and then urolithic formation in the animal. Okay, just remember this. So FLUTD, then this type of thing. Coming toward this leptospirosis. So leptospirosis, we know this is actually a zoonotic as well as contagious disease due to this gram-negative spirochetes of leptospira. So just remember the case presentation of the left you did the animal is showing stanguria, hematuria, stanguria, hematuria. The animal is showing small urine. Also the animal is this is the first time in their life animal is showing stanguria, okay, and hematuria. So that is actually the typical case presentation. So along with the any kind of risk factor, that is you also think that you're gonna find. So typical cases, stanguria, oliguria, polyuria, hematuria, in a 8 kg or 7 kg cat, or like 3 kg cat with multi cat house, okay, multi cat tree house, okay, or there could be some kind of guest, I mean, coming in the, house, any change in environment, or the stress, okay, yes. So these are the things that the signs along with the risk factor, both of them you are going to find out in the question, okay. So all you need to do is go for the MMO, then go for the pheromone, then go for antidepressant drugs, okay. So that is actually the thing. So coming toward the leptospirosis, it's zoonotic, gram-negative, the contagious by the urine. Okay? So outdoor dogs are going to get it more. Just remember this. So the reservoir are actually the rodents. So the suburban and the rural environments are more exposed to this actually. Okay. So just remember to it's very much contagious in the world. It actually causes the AKI in the people too. Okay. So just remember you actually have to wear the personal protective equipment. Okay. Due to this genetic label. So so the animal actually shed this organism in the urine for 2 to 3 days after the the urine. So you actually have to use the bleach for the disinfection of this. Okay, just remember this. And as far as the typical case presentation of this looks like, so just remember you're gonna find out tubulointerstitial nephritis, cholestatic, hepatopathy. Okay, along with the uveitis, you can find out that's very much important. Say acute hepatic injury, conjunctivitis, uveitis, the lung injury, acute lung injury, you can also find out. Okay, acute respiratory.
Recording stopped.
So, no, the
Recording in
specific
progress.
acute kidney injury, acute hepatitis, ocular injury, the acute respiratory distress, pulmonary hemorrhage syndrome. That's very much common. Okay, acute leptospiral pulmonary hemorrhage. Okay. Along with that, also remember the leptospora will also cause the thrombocytopenia in the animals. Okay, so that thrombocytopenia is going to cause this petechial hemorrhages, ecchymosis, hematochezia, hematochezia. Okay, just remember this thrombocytopenia thing. Okay, so that thrombocytopenia can also lead to a DIC. All in all, just remember the tubulointerstitial nephritis, acute hepatic injury leading to the icterus. Third is ocular injury, pulmonary hemorrhage syndrome, and the thrombocytopenia in that. Okay, so just remember all of these things are very much important. You can find out 1 to 2 signs, more 2 or more than 2 signs in the animals. Okay, just remember that. Okay, so just remember they are the renal tubules are actually harbor this on the leptospiral organisms. So deer, opossum, raccoons, rodents, those are actually the reservoir. They actually share this spirochete in the urine. From that, the other organisms get affected. Okay, so and that is actually the cycle. So just remember that the other organism can get the um, can get infected by the urine by exposing the mucous membrane or the damaged skin to the urine. Okay, So that's how actually they get affected by the leptospira. Okay. So within 7 to 10 days, the leptospiremia is going to occur, and the kidney, liver, spleen, central nervous system, eyes, and general tract, these are going to be affected. As I told you, different systems are going to be involved. Okay? So just remember, it's a disease of renal tubular epithelial cell. Okay, it's not a disease of glomerulus. Okay. Coming toward the diagnosis, it is so you can find out, the neutrophilia in these animals along with non-regenerative anemia. Also, important thing is you're going to find out thrombocytopenia. That's very much important. As I told you that there are actually direct effects of this, the leptospira in the thrombocytopenia. Directly, it's lead toward the thrombocytopenia. That's the reason that we could find out, different kind of, the primary hemostasis is the sign. Okay, that's very much important. In the serum chemistry, actually depends upon the which system is going to be involved. Okay, either it is the AKI or the hepatitis is also present. So if the hepatitis is there, so just remember this ALP is going to be more increased as compared to other things. Okay, just remember that's very much specific. Another thing is bilirubin is also like moderately high in the animals with the leptospiremia. Okay, so you find these, and in the urinalysis you can find out isosthenes. If the animal is having the AKI, you need to do the abdominal radiography and ultrasound to check different kind of organ enlargement. Okay, organomegaly. You need to do the coagulation profile to check out PT and APTT. These things you could find out with the DIC in these animals. Increase FTPs, increase D dimer, prolong the APTT and PT. Okay. So diagnosis for this is actually mad. So you actually have to do the two samples, acute and the conventional samples in the mat to diagnose this case. Okay, if the titer is more than 1:800, that could be, this could be like leptospira. So just remember, 1 sample doesn't actually tells you that this is leptospira or not. You actually have to do the two sample, like the 2 to 4 weeks apart, acute and conventional sample. That is the thing that actually tells you that this is leptospira. Okay. Another thing is PCR. Okay, PCR you can do it on the blood sample. Okay, so just remember PCR actually tells you earlier than the mat that this is the animal is suffering from the leptospira. Okay, just remember that. Initially, this mat is actually negative. Initially, the PCR is going to be positive. Okay, so you can diagnose this leptospira by the PCR earlier than the mat. Okay, just remember that. Actually, it requires a lot of time for the leptospira. After 7 to 10 days, the animal is going to show the leptospiremia, and after the leptospiremia, within a week, the animal will show antibodies. Okay, that's what you're gonna find out in the mat. Okay, so PCR actually tells you earlier that this is leptospira. Okay, it actually only tells you about this is leptospira. It doesn't tell that which kind of serovar it is there. Okay, just remember it. So so you have diagnosed with leptospira. Now it's like the time for the treatment. Okay. Another thing is you can just have an idea with the dark field microscopy. Okay. So just remember the treatment is likely you have to use the amoxicillin in these animals with the leptospiremia. Acute animals we have to use the the ampicillin, beta-lactam antibiotics, followed by 2 weeks of doxycycline. Okay, so just remember that is actually the acute treatment. Okay? So actually, this doxycycline is very good antibiotic. This actually clears even the carried state of the animal. Okay, so in the acute stage, you use the ampicillin or the penicillin. Okay, initially to clear the leptospiremia, then you use the doxycycline to clear the carried state. That's very important. So ampicillin you use 20 mg per kg every 6 or IV to reduce, with the reduction of the doses in the endemic dogs or the cats, okay, and then you use 5 mg per kg, doxycycline, okay, that's very important. So for the monitoring purposes, you actually have to monitor the liver and the renal values along with the CBC, okay. if you have, done the diagnosis and you have treated it, so just remember there are 70-85% of chances of the survival. Have to just treat it like very much aggressively. Okay, just remember that during the treatment, just remember to wear the personal protective equipment. Okay. So canine Reprospera is actually the reportable disease in the US states, within some US states. So just take care of it, you state have it or not. Okay, just remember. So you actually have to, vaccinate the at-risk dog. So also important thing is the animal with the complete, vaccination can also have this disease. Okay, just remember this. Okay. So with this, we can, finish our today's session. We will discuss tomorrow glomerulonephritis and amyloidosis first, and then we will go for the next system. Okay, just remember this. And I apologize for some internet issues. Okay, so this is actually happening these days. I don't know why. So I really apologize for that. Okay, so take care and good night, and revise these things. Okay. Uh,
Recording
from
stopped.
your Uro2 or wet prep, okay, and also take some rest too, okay. Rest is very much important for getting the things very much important. Otherwise, everything will be, okay. Take care. Bye bye. And see you guys tomorrow, inshallah.